Rapid onset gender dysphoria is the explanation of the surge in cases of gender dysphoria that has happened over the past decade, and especially the past 5 years. The idea is this: a subset of gender dysphoric cases, and now it's by far the greatest percentage, are adolescent girls who never showed any signs of gender dysphoria in childhood. They were not tomboys. They were not masculine. They did, however, have issues. A lot of them had some mental health problems. They had some social problems, and so on. In adolescence, they tended to hang out with a crowd that was unconventional and progressive and ideological. And they got the idea, based on ideology, that all of their problems are due to underlying transgender that they never knew of before. They suddenly or rapidly announced, or they decided that they were transgender, and they announced to their parents. And many of these girls, it's mainly girls, about 3/4. There may be some boys too, but we should talk about them separately. A lot of them are demanding very serious treatments, including medical treatments. They want testosterone, which has very serious effects on the body, and some of them want surgery, like the amputation of their breasts. And some of them are getting this. Our evidence in our article is entirely consistent with that. We surveyed 1,655 parents of youth whom the parents believed had this syndrome. 3/4 of the youth were girls. The parents said that indeed these youth had pre-existing mental health issues, and that the mental health issues actually preceded any indication of gender issues by 4 years. That's a long time. The youth who were most likely to socially transition. Now, social transition means changing their pronouns, changing their style of dress, changing what they call themselves, boy or girl. The youth most likely to socially transition were the ones with the most problems. That was also true for medical transition, which was thankfully rare. Only about 7% had sought or had obtained medical treatment, whereas about 60% had taken many steps to social transition. Parents said after they socially transitioned, they got worse.